Welcome to a special edition of the Latino Business Report. Today we tackle a pressing issue affecting many adults in the United States today, the challenge of accessing affordable health care. In this episode, we are joined by health insurance experts to guide you through the available options. From lack of employer coverage to self-employment, unemployment, low income are all factors that contribute to the absence of health care among adults. Open enrollment is running through January 16th. There is a window of opportunity to explore viable options and get the coverage you need. UnitedHealthcare, a leading player in the industry, is actively working and reaching out to individuals and their families in similar situations, offering them solutions for individual and family coverage. They can also explain to you the requirements needed for government subsidies, making healthcare more accessible. In this podcast, we are honored to have Claudia Amaya, Regional Vice President of UnitedHealthcare, and Horacio Huerta, Director of Hispanic Initiatives for Central Region, who will be sharing their valuable insights. If you're without healthcare coverage, tune in and discover the many ways you can access affordable or subsidized healthcare. If you are currently without healthcare coverage, tune in and discover the many ways you can access affordable or subsidized healthcare. Healthcare is more than a choice. One day it could be your lifeline. Stay with us as we unravel healthcare options, empowering you to make informed decisions about you and your family's well-being.
Welcome to the Latino Business Report. This podcast covers business, people, and issues of the day from a Latino perspective. The Latino Business Report is brought to you by TAMAC, the Texas Association of Mexican American Chambers of Commerce. TAMAC is the leading Hispanic business organization in Texas since 1975. Now for your host, J.R. Gonzalez.
And welcome to another episode. My name is J.R. Gonzalez. I'm your host, and today we have two guests from UnitedHealthcare, and we're going to be talking about, yes, you guessed it, insurance. Insurance is one of those things that not a lot of people talk about, but you know what? When you need it, you need it. And if you need it, you better have it. So with us today, I want to introduce our two guests. One of them is Claudia Amaya and Horacio Huerta. Claudia, how are you doing today? And can you give us your position or what you do with UnitedHealthcare?
Yes, of course, JR. My name is Claudia Amaya, as mentioned. I am the Regional Vice President for the Affordable Care Act business line in Central Region. Been with the company for 12 years, so nice to say that talking about health insurance and making some strives and serving people is definitely one of my passions. So I'm happy to be here. Thank you.
No, thank you for being here. Horacio, how long have you been with UnitedHealthcare, and what do you do there, sir?
Very good. Good question. I've been with UnitedHealthcare 9 years, and what I'm doing right now with UnitedHealthcare is I am the director of the Hispanic Initiative for the Central Region, and this particular case today is going to be Texas, which is a big state that I have to cover.
Well, thank you for being here. And I remember, a couple of months ago when we met in my office, and that's the reason we're here. You were just fascinating. And it's an important subject. And for the listeners that listen to us on a regular basis, we kind of use a variety. We have a variety of topics that we talk about, but each one of them is important in a different way. And if you're fortunate enough to have insurance, or you're self-employed, or if you own a company, and you don't have that insurance in place, it's something that you need, and that's what we're going to be talking about, is options. So right now, UnitedHealthcare, well, actually, Claudia, it's the open enrollment period for healthcare. Could you kind of give us a little bit of an idea of what open enrollment means and what it can actually do for a person?
Sure. And JR, if you don't mind, I'm going to take a step back because there's so many different open enrollments for different products, right? So that could be confusing just in and of itself. And today we're going to talk about the individual and family plans offered through the Affordable Care Act, okay? The people that qualify for this plan are folks that typically don't get insurance through their work, that they're not on the Medicaid or Medicare or the CHIP, right? So these are folks that are practically uninsured or don't have access to a health insurance. This is the folks that we really are talking about today, and that's the majority. Just here in Texas, we have over 2 million people that are uninsured. It's a lot of us, right? And so
Wow.
the open enrollment period for this particular group is November 1st through January 16. So we have a couple of days left for folks that need insurance.
So the deadline's coming up soon. All right. So, well, thank you for clarifying that. The open enrollment, the Affordable Care Act, all this can be confusing. So I'm going to talk to you guys right now as if I know nothing about insurance, because you know what? I really don't know that much about insurance. So we have that. Let's use me for example. If I were interested, self-employed, I'm not. Let's say I'm not covered by insurance right now, and I know I need it. I'm getting older. My knee's been bothering me. I'm getting sick a little bit more. I don't have insurance, but I know I need it. But I'm just going, I can't really afford it. I mean, it's just the prices that are out there through a lot of these companies are crazy. So how can somebody like me or a business owner out there, somebody, as you said, that is doesn't receive some of those other benefits, how can they go ahead and get affordable insurance?
Well, that's a question. That's the $1 million question, right? Everybody thinks they can afford it, but in reality, the Affordable Care Act.
In reality, you can afford not to have it.
That's true.
Right.
Yeah.
That's just going to
The
wipe you out.
risks
Okay,
are so much.
didn't mean to interrupt.
No, you're absolutely right.
Yeah.
So this is what folks need to understand. Number one, it is affordable and it is obtainable, and there's help. So the Affordable Care Act is out in the open for folks to go on and actually look at what subsidies you can obtain. So let's make sure everybody understands this. In the Affordable Care Act, there's two different types of subsidies or help that people can obtain. Okay. Number one is the federal government can help actually with the premium. So this is the month to month payment, right, of that medical plan. And then number two, there's also subsidies to help you with the actual deductibles or the usage of the plan. So there's two different forms of subsidies for folks, and all of it is based on your income and the size of your family. Okay, and what I love.
So the United
Go
States.
ahead.
So are you saying so the United States government will actually give you money or subsidize an insurance plan to help you to be able to afford it?
Yes, and
that correct?
And yeah, actually 90% of the folks that are in an ACA plan receive subsidy. 90% of folks get help.
Wow. Okay.
And the average on a monthly basis is around $500 of people that get support.
Is that for individual or is that for
Individual.
family? Individual five. And if you add family on a family plan, does it multiply by the same 500 or is
More
it
or
depending on
less.
the age of the kids?
No, it's not by age. The only two factors is income and family size.
Income and families. Okay. Now, we're talking about you're in central zone, so let's just talk about Texas for right now. Those stats are a little bit more available. How many people in Texas? You said 2 million are uninsured?
Over 2 million.
Over 2 million. Now, obviously, if somebody's uninsured and they get hurt, or they break something or get some diabetes, cancer, have a heart attack, whatever. I mean, those hospital bills can wipe a family out. They can wipe out a business as far as all the medical expenses. So with people not being insured, I mean, you got close to 2 million people not insured. There's a lot of folks that need to go to the hospital anyway and get treatment. So is that increasing the price for other folks when there's so many people uninsured? Doesn't it make sense? Does it make sense in my thinking here that if people are insured, that the cost of medical care should at least stable out or decrease a little bit?
I think what plays an important role is obviously making sure that you're utilizing your medical services to its maximum. And what I mean is that you're not waiting just when you need it and you're in the hospital, that you're being proactive of being healthy and living a healthier lifestyle, right? And so some of these plans include gym membership, coaching, all the free annual screenings to promote it. And some of them even give you some like rewards to stay healthy. And so I think what's so
Really?
important is being able to partner with the right carrier that helps you promote that healthier you, right? I think all of us, we all want that. We want to be there for our family members, right? You don't want to, it's scary to think about when something's wrong, now you're thinking the worst. But if you partner up with an organization that's serious about, going hand in hand with you on this journey, I think that's what's most important. And so obviously
So you're doing some
preventative care
yeah,
is what
preventative care. Okay.
you'll definitely
Okay.
see
No,
us market that and talk about it.
Okay.
absolutely. Jared,
Now, talking
can
about
I
yeah, I was going to ask you a question next.
sure.
With this, I know that United Healthcare is really doing some good outreach into the Latino community, and that's kind of your little bailiwick. Can you kind of tell me what you're doing there and how it differs from some of your other marketing?
Sure. This is a very good question in regards to the overall or Hispanic Latino community that's out there. Sometimes it's interesting to understand the culture, and I think that's what United Healthcare has done. It's understanding the Hispanic culture, and in understanding the Hispanic healthcare. Before we used to have the basic marketing. We had a commercial translated into from English to Spanish, or we would have a flyer and just put it from English to Spanish. But now United Healthcare has realized that it's more than that. It's being relevant to the actual Latino Hispanic family and learning and understanding what their needs are. Hispanics. It's family oriented. It's a lot of that. That physician, whatever the doctor says. In the Hispanic families, it goes, and it's very, very, normal for that. So United Healthcare has learned the fact that it's touching the family, not just the individual, but it's the actual family and bringing it all together, especially in our culture, especially when you have mom. The Hispanic mother, the Hispanic woman is the one that drives the home. It's the husband that goes out.
The matriarch.
Yeah,
Yeah.
he's the one that goes out there and provides and brings the paycheck. But it's the mom that administers. It's the mom that takes the kids to school. It's mom that buys the mandado, right? The groceries. But it's a mother also that we want to reach out to. It's those wives that we want to reach out to and letting them understand of the importance of health care. That it is important for her husband to be insured, to the husband to be taking care of his of his physicals and having his blood work done once a year and all that, because if the husband goes down on an illness, hospitalized, or something happens, then the income falls, the house falls, and then you got another level. So
Right.
it's very important for us to educate our Hispanic Latino families of the importance of healthcare. So it's not just checking the box; it's learning how to
Right.
use insurance. And like Claudia was mentioning, it's benefits more than just going to the doctor. It's more than that. It has more variety.
Well, and you're talking about that, and I'm so glad to see United Healthcare has taken kind of lead in this and reaching out to the Latino community, because there is definitely a need. I would imagine out of the 2 million uninsured, that a large percentage of those are going to be Hispanics. But also, as our own community, we have a tendency, especially as macho men, we don't like going to the doctors. We don't want to go to the doctors.
Right.
And then you have the attitude, like my rest in peace, my grandma. She would go, "No, señor, I'm not going to go to the doctor. ¿Sabes qué? Your tía Meme went to the doctor and they found diabetes. So I don't want to go because they're going to find something." I mean, it was that attitude that thinking that if I go to the doctors, they're going to find something wrong with me. So
Right.
if I just don't go, I'm going to be okay. And that has to change. Claudia, as you said, we need to get people talking about and thinking about for a longer quality of life, to keep people healthy and working and contributing. The preventative medicine, preventative measures, whether it be health, like you said, the gym, eating habits. I mean, I like my arroz y frijoles and those tortillas, but I mean, you can tell they put a few pounds on me, but they still do. So we need to, as a community, we need to start looking at it. We're a young community, but if we plan on being around for any amount of time, we need to get healthier, because I think it's, and correct me if I'm wrong, I mean, cardiovascular disease and diabetes are going to be two of the number one killers in the Latino community, and both of those can actually be mitigated. I mean, they're preventable with a little bit of care up front. So with that said, what is United Healthcare doing to get that message out to more people?
I think the first form of think the first form of responsibility for us was acknowledging the need, right? I think when you're a huge organization and by default you get numbers, it's hard to carve out an initiative or to carve out specifics. And I think as our organization evolves and we've added different products, we've learned that we too have to evolve with the membership. And so, specifically in the ACA, 45% of the folks that are enrolling into an ACA plan are Hispanics. That immediately is a call to action, the Affordable Care Act. Some of you might know it as the marketplace.
Okay, and you said what percentage are Hispanic?
45% of the enrollees are
45.
Hispanic.
Wow.
UnitedHealthcare had to respond in a different way, right? We had to look at the experience. What are we doing to learn more about this specific group? And obviously, Horacio and I both work with United, but we're Hispanics, right? It was something very personal to us. We walked through our own journeys, and it was, I mean, they're similar.
Let me ask you a question. This 45%, over the past 4 or 5 years or even decade, has there been a surge in more people going for healthcare, or is it in direct correlation with the Hispanic population in Texas? Because Latinos now are the number one population number-wise in the state of Texas. Hispanics outnumber non-Hispanic whites. So with a rising population, I could see that, but I also know the hesitancy, and there's so many Latinos that do not have health care, so that rise at up to 45%. Can you kind of backtrack, and do you know where that, is there been a surge, a conscious effort for more people getting health care, or is it in correlation with just the increasing population?
Well, I wish I could tell you I knew exactly, but CMS just released that information this year or last year.
Okay.
But I do, my personal perspective is probably goes hand in hand with the need, but also I feel that it might be underrepresented, right? Because not everybody's, even when you're doing the application, not all of us fill in that we're Hispanics, right? And it's just because what are they going to do with that information? Is it really necessary? And so we do encourage all our brokers or anybody that is affiliated with us is be proactive in obtaining that information so we can get better data. And I urge all of you, right? If you're signing up, make sure you jot down that information, because there are companies like ourselves that are looking at the information to really reflect on, do we have enough providers to serve that demographic? Right? Do we have enough agents? Do we have enough member services? But I think because in the past we haven't dedicated resources or have a strategy in place, that people just didn't think through about those, do I need to select that or not?
Sure.
But I think it's just taking action for once.
Sure.
Well, and you kind of alluded to it earlier. I mean, UnitedHealthcare, major corporation. You guys are in the top 5-6% on being traded. I mean, huge. But at the same time, they recognize the growing Latino population, and if 45% of your new customers are Hispanic, it only stands to reason, to put more services, more things, in Spanish, and really try to hit that market. So to your point, it makes a good point. If you're going to fill out those forms, make sure you fill out that you are Hispanic or Latino, whatever, Latinx or whatever the form says, because that information will be valuable so they can put even more resources into our community.
Exactly.
And the days of, I'm sorry, Horacio, go ahead.
That's a good point. Let me add a little bit to what you're saying, and it's important for us to check that box saying, you're Hispanic or Latino, because now what happens is with the UnitedHealthcare on the medical side of it, on the clinical end of it, what they start doing is doing the research and having better benefits for next year's plans. A good example of that is unfortunately 1 in every 3 Hispanos will either be diagnosed or have diabetes right now or be diagnosed in the next 5 years. So the key here is preventive care. And our clinical team is looking for those benefits that can fit right in the health, wellness, eating habits, medications, whatever the case is to get those those sugar levels down, to help these people get off these medications, and helping our Latino community understand that diabetes is out there. This brings to my mind is that our mothers are very our grandmothers and our mothers are very are believers in Vicks, and you know what I'm talking about. Everything Vicks cures everything.
Oh yeah.
And some good manzanilla and a good tea, and you're good.
And a Sprite.
There you go.
A Sprite.
There you go.
I mean, you gotta have the Sprite.
You got it perfect, but you can't forget that. However, sometimes Vicks cannot cure an infection, or when it's a drastic situation. That's where you do need an actual provider. You actually need to go to the doctor or get some antibiotics. Continue your home remedies, which I strongly believe in. But I think healthcare is more than that. I think healthcare is, again, it's UnitedHealthcare has developed a way of learning the Hispanic healthcare and embracing it and knowing what our community needs and what those differences are between other cultures and helping our families. So I think that's the key to that.
Yeah. Oh, absolutely. I mean, growing up, there was Vicks everywhere when you were sick. And if you're really sick, here comes the Webble. They'd start praying over you with that egg. It's kind of,
right.
Let's go through. But to the point, there's certain home remedies or certain things in the cultures that these are the steps that you have to go through before you even see a doctor, because a lot of this stuff can be taken care of. But Claudia, to your point, we just need to start changing that mindset. Home remedies and culture is great, but at the same time, if we can just start embracing the need of preventative medicine, that goes a long way too. I mean, herbs and teas and
part of our culture, right? In the Hispanic families, we want to be there for our children and see them grow, and we're always supportive of each other. And I think what we need to be reminded is, in order to do that, you need to be well. And so those two things go hand in hand, and we have to take better care of ourselves. And we have to be willing to receive the help that there's out there, right? Get informed, but certainly understand that there's licensed agents out there, that they have to do continuing education to offer you guidance. And there's companies like United that are very serious about serving and doing better and evolving. But there's a massive need to just at least be aware of what are all the options. And it takes whoever's listening. You might need it, your family, your cousin. There's somebody in your surroundings, in your immediate surroundings, that needs this. And I think it just is part of us making sure that we're talking about it.
Good point. And there might be some listeners out there that are the breadwinners for the family, and the person that needs it is them. And it's like, if you're not going to do it for yourself, do it for your family. Because if something were to occur and you're not bringing home that paycheck anymore, or you're hospitalized and wipe out your kid's college fund, or the your next 4 or 5 house payments are gone because you're in the hospital or something, that's preventable. It's important. There's so many lives I've seen that just ruined because of medical bills, and it's unfortunate that with a little bit of foresight, nobody wants to get sick. Nobody wants to, have some disease or diabetes or something that's really going to affect them. But it's going to happen, and we never know when it's going to happen. So with that said, we have a deadline coming up for the open enrollment of you said January 16th. How can somebody go and sign up for this and start finding out information, and who qualifies?
Well, the people that qualify need to reside in the U.S., right? They need to be a resident, and definitely...
Do they need to be a citizen? They need to be a citizen?
They could, or a resident, and they obviously have to live in the U.S. So those are the folks that can apply. And then, of course, the subsidies, like I mentioned, almost everyone can get affordable care. And it's just a matter of, hey, you can go even on healthcare.gov yourself and start an application, and automatically you will be able to see there live how much subsidy you can obtain. Like you don't even have to submit your application, but
Okay.
you can go on there and start it, just play around with it. And of course, if you want information, you can come directly to United Healthcare. We'll give you a phone number where we could probably insert or keep. And then there's also multiple ways to go into just United Healthcare. We do have Seguro Médico, ACA.com. And this is for those of you that speak Spanish and you'd like to learn more about the ACA, you can go there to learn more.
Or share it with a relative or a parent or somebody who prefers getting their information in Spanish. Okay. And what we'll do, if you guys would, on the podcast notes, I'll go ahead and put all the different website addresses that people can go to get it in English and Spanish and where to start the process. But I think I really like that. So you don't have to fill out the application and apply. You can, as you're filling out, it'll give you a projection of what that subsidy will be so you can have an idea of what your rate will be. Now, if a person, I was reading someplace in the material before the show that if you're incarcerated, you don't qualify, right? Yeah,
you get medical insurance.
You get health care in jail. Yeah. But now, how about those folks that are like Medicare, like 65 or older? Is it better for them to go with the open enrollment, or do they just stick with the Medicare plan?
So stick to Medicare plan. It's intentional. So there's all these different government-led programs. So Medicare, stay with Medicare. Medicaid, stay with Medicaid. CHIP, that's for children, right? Or if you have commercial through your employer, typically those are better options for you. This is designed for those that do not have access, are not on any of those different programs, right? Or you're self-employed, or you just left your job and now you don't have insurance. This is designed for the uninsured and don't have access.
Okay. Makes sense. Thank you. When we're looking at this and somebody applies, what's the time frame? How long will it be before they actually start getting coverage? Is there a waiting period, or will they start getting coverage pretty much immediately?
So the cutoff time is every 15th of the month. So if somebody signs up from here to the 15th of January, it'll be effective February 1st. Okay? If they sign up after the 15th, then it will be the following month.
Okay. Now, if somebody misses the deadline of the 16th,
Yep.
Is there any opportunity they can still get some sort of health insurance through UnitedHealthcare?
Yes, absolutely. So there is a special election period. Okay, so special election period lets you sign up for a plan throughout because of different situations, and I'll just give you a couple because there's hundreds of reasons. For example, you move and now you live in a different county. That qualifies. You get married, you lose your job, your health plan now doesn't exist. So right now, in the entire United States, you heard a lot about Medicaid redetermination, right? During COVID, a ton of states, they were signing people up to the Medicaid program, but they were not disenrolling them. They just kept them through that emergency time frame. And so now this year, there's many states that now you had to recertify to see if you still qualified, and many did not qualify anymore, but remained on the program. So those folks that were redetermined now have a special election, meaning they can sign up to this particular plan. But those are just a few examples. It's best for you to connect with us. Another special election is if you're under 400% of the federal poverty level. So many of the counties or cities in Texas, you'll have a volume of folks that qualify.
Yeah, and just for the listeners, when we're talking about election, we're not talking about you need to be a registered voter.
No.
I mean, we're talking about something completely different here.
Right.
Horacio, we were talking, and you're doing the Latino outreach.
Yep.
With that, have you come across any correlation? Because from what I've seen, a lot of the health providers that are out there, the doctors and health providers, there's only like 12% that are Latinos.
Right.
And I know that there's a lot of folks that just feel more comfortable going to somebody who speaks Spanish or somebody who's like them, who understands the culture a little bit better. Is there any correlation, or what is UnitedHealthcare doing to try to maybe close that gap a little bit?
Absolutely, and I want to ask Claudia to help me out on this one, but I want to share something real quick. You know, healthcare in Spanish is very important, especially for those parents that that don't speak the language correct, or they don't understand full English, and their children do. Maybe their children are bilingual 100%. But the key though is that a lot of individuals go to the doctor, and like I mentioned earlier, a lot of these patients, they feel comfortable with their physician because it's like physicians in Hispanic families is it's part of the family pretty much. But sometimes when you have an English speaking physician or provider that brings a diagnosis to a patient that is in English, and yet he or she doesn't understand the language, you have a medical assistant in the office, but the doctor talks about all the prognosis, diagnosis, and everything that's happening in that room. And when they're about to translate, the medical assistant, all they pretty much say is, "Sí, señora, you just have to take, esta pastilla, just take this pill and sleep it over, be okay, and everything's okay." But in reality, there was so much being lost in translation.
Right.
And I'm saying this because I'm going to give you my own personal testimony, and I guess because it's interesting why I'm here. Back when I was probably 11, 12 years old, I remember I was that translator for my mother when she went to the doctor. And I was the one in those rooms translating, learning the language of medicine to pass it on to my mother and her understanding what she needed to on her prognosis. And that kind of pushed me and kept me going. Went to school, learned medical terminology, taught medical terminology for in schools, technical schools. But interesting enough, practically 25, 30 years later, I'm here working as a Hispanic Initiative Director, which is exactly why I'm here now. I'm actually going out into the community, looking for organizations, coalitions, looking for healthcare providers, panels, individuals who want to help grow their Hispanic Latino community, panels in their offices. However, the importance is having those physicians that speak the language, that understand the client, the patient, that what they want to hear, maybe it's maybe they are diagnosed with diabetes, but how the doctor projects it is very different from a translation. And here, I guess Claudia can help me in regards to what we're doing in recruiting and looking for physicians to come on board.
And let me tell you something.
Well, along those same lines.
Sorry.
Real quick, Claudia. Along those same lines, I know the frustration. I mean, he recently passed. It's been about a year. But when I used to take my dad, I took my dad to the doctor one time for a checkup because Mom was having her hair done or something. And I go in there, and I'm sitting there in the examination room. The doctor comes in and takes a look at my dad. Then he starts talking to me. Well, what's going on and he starts explaining everything. I'm going, okay. And then he would pause, and he would keep on talking. I'm going, okay. At one point, the doctor looked at me and says, "What, are you going to translate this for your dad?" And I go, "Why? He's been speaking English longer than I have. Hell, just talk to the man. I don't know why you're talking to me." My dad looks up, and he goes, "I speak English, Doc." And he goes, "Oh, I'm sorry." But there's still, unfortunately, there's a lot of medical providers that make these assumptions, Yep. And it just, we got to get through it. And Horacio, I'm so glad that you're there. I mean, we need to multiply you out. And Claudia, I want to get back to you, but before we end this podcast, let us know what we can do, or if there's anybody out there. Let's get your number publicized, if it's okay with you, because there may be an organization, a group of people
Absolutely.
might want to reach out to you directly and go, "Hey, I heard this on the podcast. How can we get more involved in getting the information out to our community, to our network of folks?"
Absolutely.
Claudia, didn't mean to interrupt.
No.
Go ahead.
I just wanted to add.
No.
I mean, I've been in and out of the doctors and hospitals' offices all last year, and even in English, I felt confused. I mean, it's just confusing to try to follow up. Imagine when it's doing it in not in your language, but to think about what we are doing. Not only did we launch an initiative, but this is only a starting point. We have a long-term plan that we have to reevaluate every year. But as far as the network, or are building a better network that resonates with our Hispanic audience, what we're doing is we're asking folks to nominate providers that they're used to working. So we are working with our brokers, members. We take in all these nominations and we are sending them into our contracting team. So the unfortunate part is that there's just a deficit of Hispanic providers, period. So it's not that the lack of us contracting, there's just we need more providers. And so
Yeah.
it's going to start with us, even with our family members who are going to school. Like, let's push people. If this is something that they're interested, we're not going to solve it within the next few years. It's going to be a long-term plan. But there's an opportunity for those young people that are creating their careers, right?
Right.
There's a need, and we need more Hispanic providers. If that's something that you're interested in, go for it. You can do it.
Absolutely. And
Absolutely, and I know there's a lot of scholarships
Mm-hmm.
out there, a lot of scholarship
yeah,
money for people to go into this.
yeah. Jared, I just want to add something in regards to going back to, I guess, one of the original questions you had in regards to business owners, and if there's any business owners that are listening to us today, I just want you to know that retention is a key in any type of business. Retention is the key for anything. Anything you sell, offer, whatever in the business you're in, and employee retention is very important. And a lot of these small businesses that are out there might not, or maybe they're not able to bring an insurance to have coverage for their employees. However, something like UnitedHealthcare, the individual family plans that we have, it's exactly the key word is individual. And this means that we are there to help you, even though you might have a group of maybe 10 employees. And retention is important because now you're offering some sort of coverage to your employees and their families. Now, the beauty of it is that, as a small business owner, we're not going to touch your payroll. We're not going to pull from your payroll. This is something that's individual, and it's allowing our representatives to maybe meet, maybe do a lunch and learn, coffee and chat, and going to your business maybe for 30, 45 minutes to an hour, and just letting their employees know of the importance of healthcare coverage, and the importance of not only them as, healthcare coverage, but their family. And it's just having that conversation with their employees, and their employees, when you give them something like this, you're giving an opportunity for them to say, hey, thanks. My employer gives me the opportunity to at least choose from a carrier. And if you have any questions, yes, my number will be out. Feel free to reach out to me, reach out to Claudia, and we're here to help these small business owners and retain their employees. But most of all is you want to have healthy employees also. And that's where this comes in, having healthy employees going through their physicals annually, et cetera. So.
We should have learned about that through COVID. You need that healthy workforce, those employees.
Sure.
And, studies will show that job satisfaction for an employee isn't always about money. Mm-hmm. It's about stuff like environment and being appreciated and healthcare. Yeah. If they have that opportunity to stay healthy, those are important things.
It's being proactive,
Guys,
not reactive.
Yes, definitely being proactive. I want to thank you both for taking the time, Claudia and Horacio. Thank you very much for joining us today. Before we go, do either of you have any closing comments? And we will put on the podcast notes where people can reach you, because I think it's important, and we'll put up your websites addresses as well of where they can go and get it in English and Spanish, or where these websites can be referred to other people they may know. Because, guys, I cannot tell you enough. Your health is so important. You want to make sure that you stay healthy, if not for yourself, but for your loved ones, your family, because you're a provider for them. They depend on you. And if you get sick, you get hospitalized, then you're going to have to depend on them. And a lot of that's just not necessary. Let's just kind of take care of yourselves so you can take care of each other.
Exactly.
That's right. And
any closing comments?
I just want people to know it's affordable. 90% of people receive some type of subsidy. So if you think it's expensive, it's not. It's obtainable, and you can't afford to not have it. There's help out there. So just, be open-minded, get the right advice, get some direction, but definitely don't leave this out. Talk to your loved ones about it, and make sure you guys, this is a way of showing that you care, making sure that you're healthy.
Absolutely.
So let me translate that for you, Claudia. What you're saying, if you got a cell phone and Netflix, you can get damn health insurance.
There you go.
That's right.
Don't be pinche. Get out there and get yourself health insurance.
That's right.
Así es.
Okay. Horacio, anything you want to leave us with?
Absolutely. To all our Hispano and Latino people that are listening today, one of the things that we've learned is that we as Hispanos, we that are in the United States, we read, we think, we talk in English, but we feel in Spanish. So that's all I got to say.
Yes, and that feeling goes very deep,
Yeah.
very deep. All right,
Thank
folks,
you for having us.
thank you so much.
Yep, thank you.
No, thank you guys. Folks, you've been listening to the Latino Business Report. My name is J.R. Gonzalez. I have been your proud host. I hope you like the show. If you do, you can find us on every platform, and you can also go to our website, latinobusinessreport.com. That's latinobusinessreport.com, and find our entire library of previous episodes. We also have our episode next week coming up is going to be kind of exciting. We have two brothers out of California. They own a company called Mr. Tortilla. Oh, wow. And I mention this because it falls in line with health. Mr. Tortilla actually manufactures a 15-calorie, one-carb tortilla. So talk about eating healthy tacos. Right. They're doing that, and we can actually have some swag from Mr. Tortilla and give them away. So make sure you listen next week as well. But guys, UnitedHealthcare folks, thank you very much for joining us.
Thank you.
And let's just hope let's get people talking about it. Let's get the word out, and we're going to be pushing it on our end to make sure people know about that open enrollment deadline, and to please look into it because you guys have so many different opportunities for people to get health care. And from a personal note and from a business end, my hat's off to UnitedHealthcare for taking the initiative to understanding not only the strength, but the importance of the Latino community. Thank you very much.
Thank you, JR.
Guys, see you next week.
Thank you.